It's a real pleasure to be here. My name is Vin Kin Nguyen. I'm the co-director of the Global Health Center, and it's my pleasurable task to welcome those of you who are here in the flesh and the some hundreds more who are joining us online. The topic, of course, of today's meeting is health and climate action, and this is perhaps even more topical than it was when we thought of this as a topic because of progress in climate change mitigation and global health currently under attack. We know that climate change is not a distant threat. We experience it every day. Health organizations, including the WHO, have recognized the threat to health of climate change. We have mounting evidence that climate change is linked to heat-related illnesses, air pollution, vector-borne diseases, mental health issues, and food insecurity. And we know also that the health impacts of climate change disproportionately affect vulnerable populations. They deepen inequalities and they strain already fragile, if not crumbling, health systems, crumbling in the current context. So there's been unprecedented momentum in elevating health within the climate agenda. So to give you a few milestones, COP28 in 2023, health took center stage with the first ever Health Day. The first COP Climate Health Ministerial and the endorsement of the COP28 Declaration on Climate Change and Health signed by more than 150 parties. And this secured a global commitment to addressing climate-related health impacts. Building on this momentum, at COP29 recently in Baku, the COP presidency's Continuity Coalition for Climate and Health was launched, amongst other initiatives. This coalition brings together the presidencies of 5 past and future COPs, united in their commitment to ensuring that health remains a central pillar of the global climate agenda. At the 77th World Health Assembly last year in May, member states took decisive action, adopting a landmark resolution on climate change and health and mandating WHO to develop a global plan on action on climate change and health. This is to be presented in a few months at the 2025 World Health Assembly. And for the first time, climate change was included as a strategic objective in WHO's 14th General Program of Work, a clear signal that addressing the health impacts of climate change is now a core global health priority. So we are at a pivotal moment, even more pivotal, as I mentioned at the opening, given the current threats and attacks on climate change mitigation and global health infrastructure. So the momentum is real, but maintaining it and turning commitments into action is crucial and is going to be an ever greater challenge. So we've gathered today some of the key actors behind these historic milestones, those who have driven these initiatives and helped elevate health in the climate discourse. We're here to hear their insights. How are we doing so far? How can we build on this momentum? And how do we sustain the progress achieved up till now? So as we shift from policy development to implementation, the road ahead is clear. We must work together across sectors, governments, organizations, and civil society to ensure that health remains at the forefront of the climate agenda. So I'm looking forward to this discussion, and I have a few housekeeping announcements. The first is, of course, this event is being streamed live and being recorded, and it will be available on our website in 1 to 2 days. There will be a question and answer session later in the event, open to the audience, including, of course, those who are joining us online. For those of you who are online, very important, please type your questions in the chat box, including any address to an individual speaker. We'll be monitoring the chat box, so if you address it to an individual speaker, we won't see it. So any questions there? And I will now give the floor to my colleague, Daniela Moric, who will be moderating the event. Over to you.
Thank you, Vinky. Thank you, Vinky, and good morning, everyone. It's wonderful to see so many people here in the auditorium and also so many participants joining us online. My name is Daniela Moric. I am Senior Manager and Advisor at the Global Health Center at the Geneva Graduate Institute, and I will have the pleasure to moderate this discussion. So our agenda is straightforward. I will guide a few rounds of questions for our panelists, and then there's going to be, as Vinkin said, an open Q&A session, both for you here in the room and for our participants online. So I hope you will stay with us. So we are joined here today by esteemed experts who will be talking about policymaking and governance at the intersection of health and climate change. To begin, I would like to introduce our speakers. We are pleased to have here on my left side, Maria Neira, who is a director of the Department of Environmental, Climate Change and Health at the World Health Organization. Followed by Rosie Tasker, who is a Clean Air Liaison at the Global Climate and Health Alliance. Joining us online, and they should pop up now on the screen behind us, I think, or maybe later on, but we have from Brazil, Gustavo dos Santos Souza, who is Acting Coordinator, General Coordination of Climate Change and Health Equity at the Secretariat of Health Surveillance and Environment at the Ministry of Health in Brazil. And last, but absolutely not least, is Astrid Dunselman, who is a Coordinating Policy Officer at the Ministry of Health, Welfare and Sport of the Kingdom of the Netherlands. If you are interested in learning more about the backgrounds of our panelists, the full bios are available on the events webpage. So I think we are ready to go. And my first question today is for Maria Neira. So we heard that 2024 was a very important year. Member states adopted a resolution requesting the WHO Secretariat to develop a global plan of action on climate change and health. A draft was discussed at the executive board meeting a couple of weeks ago, and work is still ongoing. Maria, to start, can you just tell us why it is important for WHO to develop a global plan of action on climate change and health? And even if it's still work in progress, could you tell us about the key elements that form this plan so far for those who are not familiar with the text?
Thank you very much. And I understand that this is an open dialogue and people who are very much interested in an intellectual discussion. So allow me to be a little bit provocative. Is that okay? Good. So I don't want to describe your processes. Probably most of you are very familiar with the way the negotiations are taking place at the World Health Assembly, at the Executive Board. I see representatives from member states here. They have been absolutely instrumental of pushing. The whole idea behind is that climate change, as you know, is affecting any single pillar of what our health depends on it. And therefore, it was absolutely critical to bring it to the ministers of health who are represented at the World Health Assembly. We have a first resolution in 2008, so don't think that we are starting from zero. Climate change and health was very much at the beginning, and even more than 25 years ago, one of the World Health Days in WHO was dedicated to climate change and health. So it's nothing really new. We all know how much our connection with the environment is clear and is strong. But bringing this to the member states, to the ministers of health, is the way to empower them and remind them that the health argument can be the most powerful one to move this agenda on climate change and health. And this is as well the report we took it to the COP, saying, okay, those are the health arguments why you need to accelerate a little bit all of those processes. And when I say a little bit, I think a lot, and be a little bit more ambitious. Just to remind you that COP is now, this year will be COP 30. My colleagues from Brazil are there, they can tell you a little bit more. But that means that for the last 30 years, we have been negotiating something that, according to what we are all saying, this is one of the most serious critical issues that our society is confronting. And it's taking us 30 years. So maybe we need to accelerate a little bit, maybe. And then we think that by putting the health argument, this acceleration can take place. Why? The ministers of health, they need to understand that they have a critical role on that. And what we are proposing on the plan of action is exactly that. What we can do on adaptation, making our health facilities, our health system more climate resilient, and this is common sense. The interventions you need to put in place to make our health systems more resilient are public health basic interventions, access to safe water, better vector control, epidemiological surveillance for those diseases that will be increasing due to the global warming. I mean, capacity building for the health staff, better resilience from an infrastructure point of view, access to solar panels, I mean, renewable energy in our healthcare facilities instead of diesel, that we are using now when the electricity is not working. So common sense interventions that will be responding to the real needs and reinforcing the capacity. The other piece is about mitigation. And some people might say, wow, why WHO or why the health system, health community needs to look at mitigation? Well, because mitigating climate change means nothing else than doing pure public health interventions. When we talk about mitigation of climate change, we are talking about transition to clean sources of energy. Sorry, this is a huge public health agenda. It's about reducing 7 million premature deaths that we have every year caused by exposure to air pollution. What a coincidence. Air pollution causes and climate change causes overlap on at 75%, combustion of fossil fuels. Second transition to healthy urban planning on a way that we can have a more active lifestyle, less exposure to air pollution, more efficiency, energy in our buildings. I mean, measures, again, that will have an enormous benefit for our health, particularly reducing non-communicable diseases. And the third transition is about sustainable food systems. Again, incredible transition that will bring us even probably more than 5 million avoidable deaths due to the fact that we don't have healthy diets now. Is this a public health agenda? Yes or not? And I think if we are all convinced, starting with our ministers, with our member states at the World Health Assembly, then we can really move this and say, okay, this is about health. Of course, it's about environment, it's about the planet, it's about polar bears, it's about economy, but this is about health. And therefore, it's our business as the health community, and it's the business of the member states and the World Health Assembly. The little issues we have, honestly, I don't think there are real challenges. It's more on, some countries will see more balance on the adaptation versus mitigation. Other countries will like a reference to the common but the differentiated responsibility. And other countries, for maybe conflict of interest, they are not very keen on us talking too much about fossil fuels. So let's talk about renewable energy, but this will benefit our health. Is that okay?
I think this is great. Thank you so much. And excellent start. I like the energy and also the reminder of the common sense that sometimes we need. But now let me transition to Rosie. Rosie, you are the representative of civil society today. So can you tell us what, in your view, is civil society's role in ensuring first the adoption of this plan and then the implementation, and how actually these relationships between civil society, government, and IOs can be strengthened to actually enhance the impact?
Thank you so much, Daniela, and thank you so much, Maria, as well. I always love hearing you talk, but it is terrible coming after you. So I think, starting from the very basics, when it comes to things like the GPOA, civil society doesn't officially have a role in its adoption. So I think that's the first starting point. However, I think most people in Geneva and around the world who are tuned in virtually will recognize that civil society organizations are there both to partner with governments and international organizations and to also always try and up the ambition a little bit. And I think that's really been characteristic of CSO participation in the resolution process last year, and also with the CSOs, so with the GPOA, my apologies. So I think, thinking back to the resolution, what we really saw was the creation of a fantastic community that I had the real pleasure of coordinating, which brought together so many existing relationships with governments, with international organizations, with academia and research organizations. We built on a lot of trust, and we were able to share and make a lot of connections between actors. And that meant that we could bring in different expertise, those organizations specializing in health system strengthening, those focusing on specific diseases or interventions, those with particular focus on vulnerable groups. We've got really wide reach civil society is by no means one big homogenous group, but if there's one thing that we work together quite well is in our breadth and our depth of extension and reach. And so actually, and within that, being able to bring in the voices of those communities who are at the sharp end of climate change and really being able to bring those to the fore and be able to contextualize and help policymakers understand this is why this is really important. Maria's points around what we need are basic public health interventions. And no one really questioned those a lot of time, but what we don't always have is that connection in policymakers' minds, that this is as much of a health issue as it is an energy issue or a transport issue or an urban planning issue. And I think that capacity to connect actors with a common interest is really a key part of civil society role. So as a network, we're following the GPOA with great interest, and thanks to the WHO team for opening up a first round of consultation on the GPOA last summer. I think that was really great to see. And I think for kind of looking ahead, I think for us, it's really about identifying those touch points with existing climate and health processes. The UNFCCC processes are a major one. Obviously, this year, 2025, there's a request to member states to resubmit their nationally determined contributions, or NDCs. And that for us is a really valuable complement to the specific actions within the GPOA to try and see them embedded in within those climate processes, so we don't end up operating in two separate spheres that sort of sometimes connect. Although credit to everybody who's been working on this for so many decades, we have so many more connections now, but really trying to bed those together. So I think thinking about the people we work with governments, there's going to be a lot around that implementation planning, specifically what is it we want to see in NDCs, how can we get it in there, and how can we make sure that ministries of health are involved in that process. With WHO, I imagine there's going to be quite a lot of working together to try and get a lot of the technical pieces that are being identified within GPOA out, picked up, better understood and better utilised. So celebrating that, also potentially encouraging the team to keep raising their ambitions, as our prerogative is to set it as sky high. And then I think within the kind of the CSO community, looking at where are our opportunities within our existing programs and relationships, particularly when we're looking at things like collaborations with academia and researchers. And it's great, so welcome to be able to speak to the Graduate Institute. And you very briefly talked on kind of what's the relationship between civil society and government. I think it's those connections. And just a quick shout out from a recent review that my colleagues did of the NDCs that have been submitted already. But there are some really great examples. So if there's anyone from Chile in the audience, the NDC within there was really clear on the involvement of health in the development of the NDC. And that's fantastic because it really builds that support for implementation and monitoring by CSOs. And I think that engagement opportunity is so critical and something we need to see a lot more of.
Thank you, and excellent. And while we discuss the Global Plan of Action, I would like to jump to Astrid. So the Netherlands played a key role in adopting the resolution. And for those of you who don't know Astrid, she was before the health attaché of the permanent mission in Geneva, and she was one of the key forces behind the adoption of that resolution. So it's great that you are here with us today. So Astrid, how do you view progress so far? And what do you think WHO member states should do to get the plan across the finish line and then implemented?
Thank you. And thank you so much for this opportunity to join you online in Geneva. Well, Rosie just said that it's difficult to follow Maria, but imagine now me in my position following these two wonderful ladies. It's been really great working with you also when I was still in Geneva on this huge topic that is so important. And of course, I have left the up close discussions in the executive board to my successor and colleagues covering WHO and following from The Hague what you've been doing in implementing the resolution and starting to develop the global plan of action. And I must say we have set WHO up for an enormous task to give the Secretariat a very tight timeline actually to develop the global plan of action. And this was already a part of the discussion that we had during the resolution negotiation. And then I remember asking also Maria's team, are you going to be able to do this? Because my gosh, to also make the right connections with non-state actors, with all the member states, to make sure that this is a fully developed plan of action, that is a huge task. And so let me start by expressing a huge appreciation for the work done so far, and our trust and belief actually that you, as you promised during the negotiations, that you would be able to meet the tight timeline, that you actually will. So we really feel that things are on track, and there's a very clear plan outlined. And that I think that was also reflected in the discussion during the executive board. Of course, there was also the request for further consultation on the GPOA, and actually that is something that can only be seen positively, because what we're all really trying to achieve is having a well-rounded plan of action, and that includes having the civil society reflections included as well. And then, of course, we have also been faced recently with a huge new challenge, which is, of course, the financial situation of WHO. The implications of the US withdrawal are still being studied, and we're now also in the process of looking at the different possibilities to make sure we can have our priorities set and financed and covered. And in that sense, I really think that the timing and timeline of that we put on Secretariat for the GPOA is actually quite good, because we've gathered momentum, and I think if we and it's good that we now have that momentum to really coin in May this year, rather than take a bit more time and have it for next year, where you might get a sense of member states thinking that it's easier to stop a process if it is not as far along. So I really do feel that we need to keep focusing on the fact that this issue is cross-cutting, as was also mentioned by the previous speakers, and that means that it is a big task to realize and to finance and to achieve, but also it means that it will have a cross-cutting impact, which is all the more reason to have a strategic approach and make sure that we can really have WHO working on all the different issues that they need to work on. They will do that just by covering climate change and health. Might almost want to say alone, but that is of course not true. And given the current situation, I think the cross-organizational cooperation is really key. So we need to, more than ever, maybe really maximize the efficiency of use of funding, and also of each other's strengths with different organizations that are working on climate change and on public health challenges, in order to make sure that we all work on our strengths, and that should be also reflected in the GPOA. And as member states, of course, we need to help the WHO wherever we can to connect those dots, and see how we can make sure that we amplify our efforts in order to still get the work done that needs to be done. Thank you.
Thank you, Astrid. So progress, but some challenges ahead. Let me now turn to Gustavo. Gustavo, as the host of COP30, let's look a bit at the future now. How will Brazil advance the climate and health agenda? And what key priorities, actions or initiatives will you highlight in the lead up to the conference and also during the conference itself? And Gustavo, actually, welcome, because you are the most far away speaker. So we are very happy that you could join.
Hello. At first, I'd like to say that I'm honored for the invitation to participate in this esteemed panel and this renowned institute. It's a privilege to engage in meaningful discussions alongside such experts, colleagues, and shaping the global climate and health agenda. As the host of COP30, Brazil recognized the importance of the connection between climate change and health, and is committed to strengthening this agenda both domestically and globally. The country aims to increase visibility around the health impacts of climate change and ensure that the health sector is considered a strategic pillar in global climate policies. To begin, I believe it's important to provide an overview of our key activities, include the actions and initiatives we've been working on ahead of COP30. Brazil's primary focus is on adapting the health sector to climate change. Our efforts have been concentrated and structured with the National Health Adaptation Plan, which we expect to finalize by May of this year and initially implement at the federal level. So we're building this plan based on 4 key pillars. 1, health surveillance; 2, health promotion education; 3, healthcare services; and 4, science, innovation, and health technology. All actions within these pillars are designed not only to strengthen the physical infrastructure of the health sector, but also to protect the most vulnerable populations, including indigenous peoples, traditional communities, workers in precarious conditions, rural populations, and not at-risk groups, as pregnant women, the elderly, and children. We expect to deliver this plan at COP30. Beyond the National Health Adaptation Plan, we are also advancing several COP30 specific initiatives. Our primary focus is to go beyond a simple resolution, instead present an action plan on climate change and health, which we are considering naming the Belém Action Plan. The goal of this plan is to support countries implementing equitable health adaptation strategies and policies in response to climate change. This plan will align its goals and objectives with the global goal on adaptation under the UNFCCC, reinforcing the need for a unified global approach with a minimum set of measurable outcomes. It will also outline specific adaptation strategies to strengthen health system resilience to climate-related impacts. And we hope countries will voluntarily endorse this plan with Brazil. Thus, our proposal of the Belém Action Plans will follow 2 cross-cutting themes. At first, health equity, which is considered in all our health policies. And the second one, leadership and governance in climate and with social participation. Besides these themes, the main action areas of the plan will be health surveillance and monitoring, evidence-based policy strategy, capacity building and innovation. And the idea behind the Belém Action Plan is to reinforce the commitment made at COP29 by the countries that have proceeded from COPs 26 to 30. And so this ensures the continuity of health considerations within climate negotiations. We want to discuss the building of this plan throughout 2029, 2025, engaging with science, international organizations, and civil society. To support the development of this plan, we'll host 2 major international events. The first of them will be a consultative event in March, bringing together experts to draft initial proposal based on progress made in previous COPs and WHO discussions. The other one consists of a technical scientific event in July, aimed at consolidating evidence-based policies for adaptation and identifying no-regret measures, which we will co-host with the WHO. This will guide countries and stakeholders in making cost-effective decisions and prioritize interventions that best protect public health. Lastly, the Health Day is being planned by Brazilian government and want to make sure that we will engage with diverse stakeholders to prioritize adaptation, health equity. We expect to be able to adopt our action plan on a voluntary basis and have panel discussion, evidence to support this instrument, for example. Together, we believe these two moments can provide the foundations for the action plan, which will be officially presented at COP30. This plan will also be aligned with the Global Climate and Health Action Plan, led by WHO. Thank you.
So it's quite a busy agenda in the lead up. And going back to Maria, you have been leading WHO efforts to elevate health within the climate change negotiations. How effectively are the health and climate community collaborating across the two platforms? And do you see any opportunity actually to enhance this collaboration for a bigger impact, if you want?
Definitely, I see every day more and more opportunities, and I will first start by saying that civil society is playing an amazing role, and don't even underestimate the influence that you have, the good one. Which is the important one to have. We have been doing incredible things at COPs, but it's thanks to you as well. So each of us, we play a different role. WHO can go to certain limits, civil society can go even beyond. They push us, we use that push to justify maybe going and being a little bit more ambitious. So I think this collaboration is fundamental. Astrid, it's so nice to see you virtually, although I cannot see you because I'm giving you my back, but your role as well has been absolutely instrumental, as well as Peru and many other member states who have been really representing this extremely strongly and with a lot of passion and commitment. We need you more than ever now. No doubt that we are facing a very historical moment, maybe historical, definitely historical moment. A moment where more than ever we need to prove that we are very relevant. And what we are talking about is fundamental for public health. It's not taking a lot of resources. That is another thing. I think it's at this time when we need to talk about efficiency and cost saving and all of that, I need to tell you that the resources in WHO dedicated to climate change are less than 5% of the whole organization. So it's not an argument that nobody can use now to say focus and cut and now that you need to do efficiency. At the contrary, I think those funds are used to do something that we all forgot about it, which is called primary prevention. And primary prevention is not secondary prevention. So when you talk about prevention, people say, yeah, early detection of cancer. I say, no, that is secondary prevention. It's extremely important, but we want to do primary prevention. And all the things we are doing about climate change and health is nothing else but massive primary prevention. So how can not be in agreement, all of us? And of course, we need to be even more ambitious. We need to go even for more and give very precise targets. A pleasure to work with Brazil. I'm sure that Brazil will put the bar very high, or at least no pressure, Gustavo, but we are hoping and having very, very high expectations about you. And Astrid, I think you put at a very critical point, and it's very relevant to the conversation as well, which is the cross-cutting. I saw among the participants colleagues from the malaria group. This is about malaria. This is about dengue. This is about emergencies. This is about antimicrobial resistance. This is about nutrition. This is about maternal health. This is about mental health. So clearly, there is a critical need to now drive this effort that everybody incorporate on an intelligent way, not duplicating or reinventing, but on a strategic and tactical way, incorporating climate change elements into their programs. And that's why we have created a steering committee in WHO making sure that we bring the 3 levels of the organization, but as well across the different programs to make sure that everybody understands. As I say, we need collaboration and opportunities for collaboration with anyone understanding this issue. One of the beautiful platform we have put in place recently, and you know that very well, is ATTACH, the Alliance for Transformative Action on Climate Change and Health. And you can't imagine the motivation that this is generating. And it's cheap motivation, because it's about how the health system can contribute by decarbonizing and reducing our own carbon footprint. So you have the director of a hospital in a very rural area from the director of a big hospital in Milano, and somebody working on the private sector, everybody saying, okay, we can reduce plastic use here. We can innovate on new materials that will replace plastic here. We can do telemedicine. Little detail, if you want to do telemedicine, you need to have electricity. And that's why we want to solarize the healthcare facilities, because otherwise they don't have access to electricity. We are discussing with our colleagues how we can be more efficient in the use of water, chemicals, electricity, plastic procurement. By pooling this procurement, we can have an incredible effort. So my point is that the collaboration is the issue here. We need to collaborate from academia, from institutions, civil society, activists, people with common sense. You are all called to this. People who believe on public health, please join us, because this is a critical moment, but we are not stopping. At the contrary, we will prove that this is the most cost-effective, efficient, common sense and a strategic decision we can take to ensure primary prevention for us, and not filling our hospitals and then requiring others to do secondary and tertiary prevention. We want to focus on primary prevention. Thank you.
I like that. Rosie, now back to you. So the Global Plan of Action will guide work in this area through 2028. So how will you measure success in 2028? What are the key outcomes and progress that you want to see to call this initiative a success?
I think it's a really good question. And I think Maria really sort of nailed it when she was saying collaborations, because I think for us, that's going to be the key thing, our key hope, is that the collaborations that we have at the moment are wider, deeper, and stronger. But within that, I think there are sort of a few thematic areas that we're really looking to, we've got high hopes for. And I think the first is around better data. As CSOs, many of us engage in evidence-based advocacy, and we've got fantastic sources like the Lancet Countdown. If anyone isn't familiar with the Lancet Countdown, go and check it out. It's phenomenal. Marina Romanello and the team do an amazing job. But one of the key things in GPOA is also then trying to improve a better understanding of what's happening at different national bases. And the WHO team has been phenomenal in this, but actually scaling up our understanding so we can look at those systems, like Maria said with the ATTACH framework. Where are things not working as we want them to do? How is it that we can use better national data to go, this is what we should be doing differently, and here's where you can find some advice from WHO, and here's some fantastic research that's taking place nationally. And that's, again, coming back to collaboration. We'd love to see more work taking place with this to support member state planning, and obviously as a CSO, evidence-based advocacy. I think kind of aligned with that is better planning. I think we are seeing more and more countries developing health national adaptation plans, and that's phenomenal. But not to bang the drum again, NDCs, we really need to see better integration of health into NDCs, and also a better understanding of health within the NDC framework as a key mechanism. We're not asking for these things just as an extra, an extra investment, an extra burden for countries. They're going to help in so many ways across the swathe of action that we need, and being able to bring those actors and those arguments to that place. And within that, cost things out. We know it's really hard to mobilize funding, and funding is a real shortfall. But there are things like the Climac H tool, which helps to demonstrate return on investment. So better thinking through how we're going to be doing this a bit more systematically. And I think a key one for GCHA is to continue seeing more and more health actors getting involved in COP processes, COP negotiations, to make sure that health is more systematically within that. And it's so fantastic to hear from both the government representatives. Astrid, hi, I realise I'm facing the wrong way for the wave, and Gustavo, it's great to hear what you have planned. But we're seeing this picking up more and more and more, but we really need to make sure that health is in there from the get-go when we're talking about those plans. Third one is better implementation. And I think that comes back to the cross-organizational cooperation, cross-sectoral cooperation. And then one final one for us is a commitment to fossil fuel phase out and just transition, because we're not going to be able to do this without. We know that fossil fuels are a major health risk factor. Maria's already highlighted the kind of key stats on that. We're living with the effects of previous inaction already, and we know that protecting human health is not compatible with future fossil fuel exploration and exploitation. So that's something we need to be really clear on, and that's something we'd really love to see coming out more and more strongly as a result of processes. And I think the GPOA is a great way of mobilizing and bringing the health community on board with those arguments.
Thank you, Rosie. All very important points. Now, going back to Astrid, what do you think that governments should do to ensure that health continues to be a priority within climate action in general?
Unmute there, sorry. Yes, thank you so much. And this is such an important question, again, because we have taken so important steps now, and it would be such a shame to lose momentum. And at the same time, we do see a more conservative political trend in the world. So even with a tendency to deny the role of climate change point blank. So it's really not a given that we can continue the track that we're currently on for connecting both issues. And at the same time, I also want to be positive and say, so we also have a more conservative or right-wing government after our elections compared to the one that started off the work for the resolution that we co-chaired. And yet, still also for our current government, climate change and health is still a priority. And the reason is, and you might have heard me say this before, but health is where climate change gets personal. So we all will experience the effects of climate change in our well-being and those that of our families. And I think that is, politically speaking, also really still an issue to really follow through with this agenda. And I don't think it's a coincidence for our ministry that the topic is actually under our State Secretary for Prevention, Youth and Sports, because he really recognizes the importance of taking measures on this to truly prevent health issues before they even arise. Actually, as Maria just mentioned, primary prevention. So I think that is really a positive take that we should keep in mind in also discussing this issue and making a case for this issue. And as the Netherlands, we have advocated to look into the effects of our healthcare system on climate change itself, so the mitigation aspect. That doesn't go for all countries, of course. This is also really an agenda for high-income countries or countries with a modern healthcare system, if I can use that terminology. And because, for instance, for the Netherlands, we have a footprint of 7%. Our healthcare system has a footprint of 7%, which is more than the aviation industry. So these kind of such a number also really brings home, I think, the issue for our colleagues that need to be working on climate change and health, and that are working on climate change, to really introduce that issue with our colleagues working on that agenda. And that is exactly what we're also now doing. So we're definitely not there yet, but we keep on promoting the inclusion of health and climate agendas. And also are introducing the issue of climate change with our health colleagues and saying, okay, so when we're shaping our health policies, can we also look at the impact of our footprint for climate change? So a health in all policies approach is of course necessary. And then one issue that is more particularly for, I think, interesting for instance, for the more conservative or parties with an economical agenda in mind as well, and that is to really stress co-benefits. And interestingly, this was a point of discussion for member states during the negotiation of the resolution, whether that it was appropriate to include co-benefits in our text. Yet the IPCC is very clear about the co-benefits by linking, for instance, mobility and preventive health for climate change interventions. And I think for our political leaders, building a business case and including the private sector in our policy development and support is absolutely key. And in order to build business cases, then that is my last point, that actually links also what Rosie said. Better data is absolutely necessary in order to support evidence development and to be able for us also to continue making the case and keep working on these issues and keep working on having health as a solid part of climate change prevention and interventions. So I think I'll leave it at that for the moment. Thank you.
Thank you, Astrid. Now I was hoping if we can zoom in a bit and look at the national experience of Brazil and how Brazil is addressing the link between climate change and health in its national policies. Gustavo, over to you.
Okay. As I've mentioned, Brazil is working on its national adaptation plan for the health sector. This plan established concrete strategies to prepare the health sector for climate challenge. It includes adapting health facilities and hospital infrastructure, strengthening epidemiological surveillance, and training healthcare professionals to respond to extreme climate events. Most importantly, it prioritizes vulnerable populations, ensure that indigenous communities, traditional populations, and not at-risk groups have access to healthcare services in emergency situations. Another critical initiative was the creation of the National Situation Room for Climate Emergencies in Health. This structure has already played a key role in response to severe droughts and wildfires in north of Brazil. It allowed for the rapid distribution of safe drinking water and emergency medical support to affected communities. It also serves as a centralized hub for climate and epidemiological data, helping us respond faster and more effectively to extreme weather events. We are also supporting states and municipalities in developing local climate adaptation plans. It's crucial because different regions face different challenges. As in the South and Southeast, our focus is on flood and heat wave preparedness. Otherwise, in the North and Northeast, we are addressing extreme drought and wildfires. Hence, this decentralized approach ensures that adaptation strategies are tailored to regional realities, making them much more effective. We intended to further explore how to address climate-sensitive diseases and expand the health surveillance system. So we expect implement or improve our early warning system for vector-borne disease, related illness, and respiratory conditions caused by air pollution, for instance. And in remote areas, we are investing in telemedicine and mobile health units to ensure that healthcare remains accessible during climate crisis. Finally, Brazil is actively engaging in international climate and health negotiations. For this, we are working with global organizations to make sure that health is at the center of climate discussions. Besides, we understand that universities and research centers are also playing a key role providing scientific data to guide evidence-based policymaking. Brazil understands that health is not just a consequence of climate change. It must be a key sector in the climate response. Through these actions, we are showing a strong commitment to adaptation, resilience, and equity in our healthcare system. And as we move toward COP30, our goal is clear: to elevate the climate and health agenda, both nationally and globally. Thank you again.
Thank you, Gustavo. I think that now I'll stop with my questions and I'll actually give the floor to our audience, both here in the auditorium and online. A quick reminder, if you are joining us online and you would like to ask a question, please type it in the chat box, and my colleague is monitoring the chat and will be able to ask the question on your behalf. If you're in the room and you want to ask a question, just raise your hand and my colleague will get you the microphone. While we're going to take maybe one here and one here and one here. Okay. And Ellen, also I see that you're raising your hand. So you have a question already from online?
Okay. A question, first one from the online speakers. Do you think the environmental actors should have a role in implementing the WHO Global Plan of Action on Health and Climate Change?
Excellent. Do we know who do we want to address this question to, or the panel? Any volunteer? Yeah, maybe we are, if they're ready. Yes, you're ready with the microphone. Okay, maybe we take one here and one here.
Sure, thank you. Carlos Dora. I'm a public health physician and I work with climate and health. Used to work with WHO, now I'm working with Brazil, where I come from. And my question, perhaps the big threat that we have in Brazil including, is that if the elections in 2 years go the opposite way that we want it to go, we'll be having all the policies, including the Amazon and all the health, going down the drain. So the question is, I understand very well the intergovernmental process, and I'm very pleased to see the way things are going well. But how are we building capacity in civil society at the urban level? 85% of the population in Brazil lives in cities. Are they part of the movement to create better cities because there's mitigation, because there's co-benefits? You know, you could see the logic there. But still, the priority is going on the adaptation side. Wouldn't that be a case for Brazil thinking forward in terms of the next elections, considering that the electorate is in cities, to work more clearly on the urban areas as with climate and health as a political issue? Because that's what it is. We're seeing what's happening in the US, we're seeing what's happening in other countries. Those are the big threats. And I think in public health, we have, because of the primary prevention argument that Maria has brought very clearly, we have an entry point that perhaps we're not using as fully as we could be. So the question is, and I think cities have part of that, that response. They don't participate in intergovernmental processes normally, which are mostly in nation states. But I do think that perhaps one should be looking more closely. And in the past Trump administration in the US, cities have been able to continue climate work in spite of the national policies. So I think it needs some reflection there, and I wonder what thoughts you would have. Thank you.
Thank you very much. Maybe we take another one on this side. And
Thank you. My name is Alexandre Robert, and I'm a health program manager at the Climate Action Accelerator. I'll give you a little context and then my question. We have a project with the French Development Agency, and next week I'll go to the Finance in Common Summit in South Africa. It's an alliance of public development banks, and they fund about 10 to 12% of the world's investments. And health is not at the agenda. We had to push a lot to have a 30-minute session. And my question to you related to the topic today, it's turning frameworks into reality. I think finance is in two here. And so how are you engaging with the financial sector to turn frameworks into reality? Thank you.
Thank you very much. So you didn't mention who you are addressing your question, but I was thinking that maybe Rosie can take the first question on the role of environmental actors within the development and implementation of the GPOA. Then the second question was addressed, I think, to the Brazilian representative. So Gustavo, for you, the second question, and maybe the last one on financing. We can see what Maria has to say. But why don't we start with Rosie? Thank you.
Thanks so much. I think in brief, we've seen that environmental actors have a really, really strong role to play. They have a fantastic complementary expertise set. So when we're talking about climate and health, you know, I think it was Astrid said that, you know, health is where climate gets personal. And I think actually being able to reach out to and work very closely with the environmental groups has helped us kind of marshal some of those arguments, some of that data to make the case much more compelling. There are some really interesting things going on as well within the environmental space. So the biodiversity meeting, Big Commission meeting last year, for the first time had a health paper, which was talking about the impact of biodiversity loss and the importance of biodiversity on human health. So I think there is a real sort of large group of organisations who we can tap into and who are already tapping into us as health actors. And maybe kind of shadowing Carlos's question slightly, we've seen that quite a lot at the subnational level. So where there have been political changes which may be less friendly to ambitious action on climate and health, it has been collaborations between health actors and environmental actors who've kept things moving at a subnational level, particularly kind of urban environments. And we've seen that with clean air measures in cities and things like that. But I don't want to talk over Gustavo because I'm really interested to hear what he says.
Excellent. So very important to collaborate with them. It's kind of a theme that's coming out, collaboration, all hands on deck. Going back to you, Gustavo. So a question about how do you build capacities in society? How do you build a social participation so the society can continue the job even if political landscape change?
Hello. Many of these questions are in our mind, and we working to produce some results that we can't specific now. We are joined to another actors to build the plan and develop a strategy to continue after another government with the inclusion of social participation and civil organizations, and this will be well described in this in our plan with the point that each actor, stakeholders should be done for adaptation and for other issues related to climate action and related to health. And it's not clear so far, but we have some contact. We are expanding our network in groups to guarantee more equity, more participation of and including all the people affected and bring to our policies strong and establish as an effective action for our policies.
Thank you. Astrid, I didn't give you the floor directly, but if you would like to react to any of the question or statement made by the other speakers, please feel free to jump in.
Thank you.
Sorry, just to interrupt you, I was reminded to tell online speakers to speak a bit louder because the volume here is a bit low. Thank you.
Okay, Sorry, I'll do my best. I hope you can hear me more clearly now. So I thought I didn't hear the name of the second person to ask a question. I think from the room, he was a physician from Brazil. I thought it's such an interesting and very, very important point to make, that actually also but also I never looked at it from a political perspective or a potential political or constituency base, as I understand the question. And I think that is a very strategic way actually to look at it. Also for those in power currently who do have who wish to continue a policy like this too. So to look a bit more, and also where is the constituency that will need to be able to support this policy in future and make sure that they feel the need and the benefit of actually the policies that we are implementing. So that's a very interesting point. I do feel in Europe, we are on that track as well. At least there's one of our mayors of one of the big cities, which is a very relative term in the Netherlands, but one of our big cities. She's actually chairing the European Mayors Network and actually trying to address the issue of climate change and health. And that is definitely a point where we'll also need to work not only for the political future of this agenda, but also, of course, very practically for a successful implementation and good results on climate change and health. So very interesting point. And then on the point of the financial sector, that is actually is very good to hear, or disappointing to hear, of course, that health is not on the agenda upcoming, but on the other hand, that also means that there is work cut out for us as well. So looking forward also to strategize a bit more, perhaps also with Maria on how to work on agenda setting for this issue, also with those partners. Thank you.
Thank you, Astrid. And maybe I can give the floor to Maria if she wants to add anything on the financing summit without health in the agenda.
Well, if you allow me, I cannot resist to insist on the other two as well. So, but really 1 second. First, I think the question on the environmental actors' role, I think it was a rhetoric question. I think we are all convinced that no way to do without each other. We need to support. The only thing is that for environmentalists, maybe they used to say, when you do environmental interventions, don't worry, you will receive health benefits. But if you plan from a health perspective on those environmental interventions, you will obtain before and bigger health interventions. So this collaboration is fundamental, but I'm convinced personally that if you use the health argument, maybe we can advance a little bit more together. Carlos' point, I mean, is absolutely right. Carlos is the one who has been responsible for the particularly the air pollution agenda and developing the guidelines and everything. So he's somebody who knows very well. And if we are having some successes now on reduction of air pollution, is a city level. So you are absolutely right, Carlos. The interventions are now more and more relevant by mayors, by municipal authorities, and those are the authorities that can have this intersectoriality and the capacity. When you say that this maybe we are focusing too much on adaptation, it's interesting because at the EB, some member states were saying, yeah, and I think you can witness that. Some member states says, well, you are focusing too much on mitigation. And others are saying, no, you are focusing too much on adaptation. So please keep us pushing us and telling us, reminding us that we still need to do both on a very strong way. But I am completely convinced and converted on the urban health and how much the mayors are the new ministers of health. The new or the old, I don't know, or both. But definitely all the interventions are very much in the hands now, for geopolitical reasons and others, in the hands of that. I'm so disappointed that health is not represented, but thanks God you are there. So make sure that Agnès Soukat is involved, because if you talk about the Agence Française de Développement, I'm sure that she is there. We have been trying to put together a panel defining the principles for financing climate change and health. We have the development banks. We have Asia Development Bank. We have a World Bank. We have a working group under ATTACH, co-led by Agnès Soukat from the Agence Française de Développement and the World Bank. So hopefully, and Astrid, I'm sure that you can give us more ideas, but this financing, again, makes a lot of sense, because the banks are now lending or giving loans to the countries, and we can influence that a little bit or a lot. So I think it's one of the issues where we need to move very strongly. And I want to use 1 second to talk about acronyms. Guys, be careful with the acronyms. We are all assuming that everybody knows what WHO is. And let me just an anecdote. When Marina Mayer and we started to run after the big bosses on the COPs, at one point we were saying, oh, we are from WHO. And then I still remember Cristiana Figueres looking at me saying, who? And I say, yes, who? Exactly, who? Well, Cristiana Figueres today is a super converted and convinced of the importance of climate change and health. But my point is about NDCs. I asked a big group of very senior people related to health, can you tell me what NCDs are? And they say, of course, Maria, non-communicable diseases. And I say, no. NDCs is national determined contribution. And this is where we, as the health community, we can have an incredible impact. But in order to have an incredible impact, we need to know that those NDCs exist, and you, as the Ministry of Health or others, you need to understand that you have a role. So careful with the acronyms, assuming that people understand, because it's not always the case.
Responsibilities for both communities. So, Ellen, do we have some question from our chat?
We have many. I'm making a selection. The first one, I think, is directed for Rosie. The second for, let's say, Gustavo. And the third is for Maria. So the first, Rosie. Somebody is asking if you could give insight to what is the data and evidence that's lacking that would help in developing policy and driving change. That's one thing. And we do have a lot of people from research institutions and academia online who also are inquiring how can they be involved in help, and that's one way. And then for Gustavo, how do these processes connect with the ordinary citizen who can actually shape the agenda within country governments? And Maria, where'd it go? Oh yeah. This is a question from Health Policy Watch, is a media outlet here in Geneva. The US this week said they would continue to support the World Food Program, but they want them to quit talking about climate change as a driver of food insecurity. How could WHO respond if the US were to ask WHO to drop its climate agenda as a condition to return to the agency? Sorry, I made the selection. Kill me.
I let you think about this one, and maybe we can start with Rosie, an insight of the type of data that we are lacking and that would be useful.
So I think it's a really good question, and I think it's going to be one of those annoying answers. It depends on which country you're in. So I think having a chat to organizations around the world, availability of data varies quite significantly by country, but I think the core kind of trifecta of information that a lot of health organizations need is what we talk about: head, heart, and pocket. So logically, what's the disease burden associated with climate and health? And that can be quite difficult to understand in different contexts. What are the recommendations that we need? Do we have analysis about the effectiveness? And it's amazing to be able to look to WHO for guidance on that. And then how much is it going to cost and what's our return on investment? And I think for academic institutions, there are really clear opportunities to engage across all three of those. So I think one of the places that we've seen sort of some of the greatest progress is in things like air pollution. So we've got some really great global figures on the disease burden associated with air pollution globally. It's about 7 million deaths per year, but that varies quite a bit by, obviously breaking it down varies quite a bit by country. And we know certain governments aren't keen to see those big global figures, but we don't necessarily have that same data at a granular level. And actually, in some instances, that's where cities have been fantastic because they have much better monitoring. They're able to pick up on some of those pieces and go, well, we can't extrapolate for the entire city, but in city A, in city B, this is the challenge that we're facing, which then means that you've got a clear kind of target that you can say, actually, by implementing an active transport policy, by improving public transport, by improving green spaces, this is what we can do. And this is how much it's going to return to us in terms of we've got a healthier population, not only physically, but mentally. And then also this is how much it's going to return to us in terms of our economic benefits. I think on that, and maybe speaking to the previous question about how to engage with kind of financial institutions, the well-known, incredibly left-leaning World Bank came out with a fantastic report a year or so ago, which was on the cost of air pollution. And it came out with some truly shocking figures. So that might be one to, I imagine you've already seen it, but if not, I'm happy to send you the link to it. It might be something that's quite interesting to kind of build into the conversations in South Africa next week, because the World Bank is incredibly conservative often in the figures it puts on this. And it's in the trillions that they're saying it costs us in both implicit and explicit subsidies. So I think that's one piece within that. So what data and evidence is lacking? Quite a lot. Fuzzy on mortality. There are some questions that can get raised about it, but I think there are lots of opportunities for partnership, and I think they're really important.
Thank you, Rosie. Going back to Gustavo, how do we connect with ordinary citizens? You are muted. You're muted.
Our plan is designed to reach all the vulnerabilized people. Naturally, we'll include ordinary citizens. Besides the focus on equity, it's important part of our plan, and the citizen is also included in all the plans and policies are thinking in all general and ordinary citizen, and all the actions that we will propose will consider all the citizen plan, and specific actions can be consulted in this plan that is in a phase of public consultation. It's not available, but will be available soon. There's no, we are in phase of elaboration, and so we have no one was more, but more than $1 million questions, and this is the this is how we working to respond many of these questions.
Excellent. Thank you. Going back to Maria, are we dropping the climate change and health policy to get the US back?
I think the question was how WHO will react. And of course, I'm just a little piece of WHO. I'm not the WHO, so I cannot provide a complete answer as the colleagues of journalists will like to see. But what I can tell you is that definitely we want the US back to WHO. We don't want them to go. It's an extremely important member state among the 194 that we have. What I can tell you as well is that at the executive board, during the discussions around climate change, you have many countries in Africa saying, you don't need to explain me what climate change is and how it's affecting health. I know very well, I see it every day. The same in Asia. I can tell you as well, and this is another very strong argument, that when you look at the Global Health Observatory, you will see that now the risk factor for health, number one, competing very heavily with tobacco, is air pollution, exposure to air pollution. When you look at issues related to vulnerability and displacement and all of that. So I think we have a big catalog of arguments to dialogue around that. And this will be my response. I appreciate the opportunity to discuss. We have a catalog of reasons why we are identifying climate change as one of the biggest health risks. And the reason why is because we need to do something about it. We need to prevent. So maybe we need to start by the end and saying why we are doing this, and then titles and I mean the names, but it's all about, as I said before, public health interventions, basic public health interventions that we need to take care. Who will disagree with the need for epidemiological surveillance, for increased number of dengue cases in Southeast Asia? Because there is an increase on dengue cases in Southeast Asia, so we need more epidemiological surveillance. Who will disagree on the need to increase the quality of the air we breathe? So maybe those are the arguments that we need to use, and as I say, we have a big catalog, and we will be very happy to have the opportunity to dialogue around that.
Thank you. I think we have the time to just maybe take one or two questions here. So there is one here, yeah, and one on the other side. If you can introduce yourself. Okay, it's fine. Oh. Go ahead. We're gonna take both.
Yeah,
How
we
about
got
that?
the last words.
Yes.
Yeah, thank you very much. I was thinking about NCDs and yes, non-communicable diseases as a national determinated contribution, and Mrs. Neira make it more clear. And this is, yes, it's a program have been setting up in WHO since 10 years ago, determinated, and that's a principle launched in Paris. Yes, what I want to raise as a questions, yes. Last year, the COP crashed with the desertifications, UNCCD COP. Yes, and this year we'll have also, but not in the same time anyway, on July, the Ramsar State Party Conference on humid zone. Yes, I'm asking Gustavo, Mr. Gustavo, if you are hopefully taking care of the input of the next COP of humid zone, Ramsar, for our UNFCCC COP this year. This is what I want to raise, not more.
Thank you. We're going to take the question from the gentleman next to it, and then...
Thank you very much. Robert Bos, I'm Senior Advisor to the International Water Association and also former staff member of Maria in her department. I'm very pleased to see how the processes around climate change and health have accelerated the last couple of years at the international level and also at the national level. But then it will, even if it's now accelerated, it will still take some time before it reaches the grassroots level. And I was wondering whether at the end of the road, which is one of the nuts and bolts there, is the whole issue of a regulatory framework to sort this all out. Once you have legislation, then you need to operationalize that legislation through regulation. So I was wondering whether WHO is doing anything with the member states to also work at that end of the story and see whether regulatory frameworks can be strengthened to ensure that climate and health are being taken care of. And I would like to ask also Gustavo whether in Brazil there are any actions going on at that level. I know that in a recent cover page of The Economist, regulation was actually declared to be a dead duck in our time and age, but I still think that there's still a lot of room to move ahead at that front and really make it something that has an impact at that grassroots level.
Thank you. And one last question from, yes.
Good. I'm sorry, I didn't understand the first question. Could you summarize for me?
Yes. So
from one word?
We're going to try to get another question from the audience, and then I'll summarize the question for you.
Well, thank you. I don't want to miss, but I think there was a hand over there that's been for a really long time. Very quickly, there's one thing that I've been trying to wrap my head around and trying to understand what that means for us. My name is Cynthia. Thank you very much for the conversation. What we've seen with the US withdrawal from the multilateral organization has also been a lot of, to me, what I've kind of been seeing is incredible reliance on a bunch of American billionaires, with Bloomberg stepping in for the US, sorry, I don't know if you hear me well, but with the Bloomberg saying they would step in for the US environmental engagements, and then we know that when the US removes itself from the WHO, the second biggest donor is the Gates Foundation, and I'm just trying to wrap my head, because one of the things that was discussed today is it's not only about caring about health or environment, it's also about understanding that it comes with discussing the economic system at the bottom, the fuel-intensive economic system that is underlying it. So, and maybe my question is for Maria, how do you see us collaborating with those actors? What role are they going to play in this weird transition that we're facing? And how can we understand their role as civil society actors, but also bigger than some governments, and what are they playing? Thank you.
There was one question here. Let's take it, and then we're going to wrap up.
Thank you very much, Catherine Rice, Health Diplomacy Alliance. Thank you for putting together this work. I think all the resolutions that are being negotiated now for the Assembly, they all have the component and the reference of how the process was negotiated. So I have a question more on going on what you have mentioned, Maria, on the fossil fuel. How we balance the development of certain cities, countries that require good health infrastructure, while at the same time these renewable energies are quite costly for those countries.
Thank you. So maybe we start in the room with Maria. There were a couple of questions directed to you.
Easy ones, huh?
Yeah, the easy ones. So how do we, so billionaires stepping in, how do we deal with them? How do we work with them? Fossil fuel, and then also the regulatory framework. How do you work with member states to enhance regulatory framework at the national level?
Well, definitely those questions are absolutely critical. I don't think we can address it in 30 seconds. I mean, legislation, billionaires, and the balance and the need for transition. I would love to have yet another hour, and not for me to tell you, but to hear from you as well, because this is a critical thing. We all recognize we are on a transition, so it's not a question of phasing out tomorrow. We all recognize that there will be a transition. Of course, in the name of health, we want this transition to happen as soon as possible. That's, I think, can summarize. But of course, we recognize that we cannot. We are even in India. There is a program of liquefied LPG. We recognize that this can be a transition as well for allowing people to cook in the meantime and having some resources. So definitely this transition is happening. And if we put all the support from all the institutions and activists and keeping the argument and providing again the health argument and then monitoring the good results when you accelerate the transition to renewables, I think is the best way to do it. But of course it will be a transition. Legislation, Robert, I think is fundamental, but in all aspects of public health, I think one of my dreams will be to have a legislation on air quality standards based on the guidelines we have developed years ago. But of course, all of those standards are voluntary standards. We were very happy to see that the European Parliament, just now, the European Commission approved a directive on air quality, which is very ambitious, not yet what is recommended by WHO, but still. So those steps are there, but I agree that everything now is voluntary, non-legally binding, and all the negotiations at COPs are non-legally binding, starting with the Paris Treaty, which is a non-legally binding treaty. But that means, and links me to the other questions, is our role as citizens, independently where we work, to put pressure on our governments and remind them their commitments at the NDCs, at other places, and then hopefully with that we can ensure this movement. The role of billionaires, they are always very much welcome. Very, very much. Where are they? Because we will be happy to discuss, provided, of course, that we keep equity, as Brazil was reminding us, and we use those resources to still ensure well-being and our society, a certain social protection, and not only economic development, or economic development, but with social protection and well-being. But as I say, this is a debate that will take hours, not just 30 seconds.
I'm looking at the time, and what I'm going to do is I'm going to maybe liaise with the question that were not answered and the speakers, because we have 4 minutes away. There is a reception, I think, and my colleague would like to share some closing remarks before we wrap up in time for 2 o'clock. So I would like to invite Ellen Roscombe to the floor, to the stage, for closing remarks.
Thank you, Daniela. Thank you so much to all of the speakers today. This has been such a provocative and important event, and we're really grateful to our co-sponsors, WHO and the Global Climate and Health Alliance. And thank all of you online participants and in person for joining us. The chat box was on fire, I can say. Please, if you would like to find out about all of our future events and keep abreast of them, just go on our platform website, www.ghplatform.org. Thank you. And our next event will be the 78th, on the sidelines of the 78th World Health Assembly, our annual open briefing, which will be on Sunday, May 18th, from 11:30 to 1:30. So we give people a chance to get down after the walk the talk. And the title this year is Critical Perspectives on Multilateralism in Global Health in 2025. And we are aiming to hear, amongst other things, from ministers of health from the 6 WHO regions about their priorities for WHO from their regions. So hopefully this will be a provocative and a very informative event. And then we have, that's the Sunday, we have Monday, Tuesday, Wednesday, side events during the week. So come down and join us. You can find everything on our website. We also put on our website the whole list of all the about 300 side events around Geneva during Health Week. So if you want to kind of keep abreast of what's in town, ghplatform.org. I want to thank our team for all their hard work to make this event happen today, because it really takes a village. Bettina Zago, Erica Schinnebarger, and Eva Greenup. And for those of you here in person, please join us upstairs for a reception.
Sorry, Maria was just asking me if we can remind everybody of the global conference on air pollution, which is taking place in March in Colombia, because otherwise her colleagues are not going to be happy with her. So now you know. Thank you, everybody.
Thank you.